Okay, First Amender, go ahead and explain. Go ahead and explain it. You got 50 seconds, and then it's going to go back to open dialogue. Okay, go ahead.
No, I've got a series of questions to ask him. That's what we're doing here.
Yeah,
that's what we're doing.
Okay, so you want to shoot out to open dialogue already?
I've got a series of questions that I want to ask him to determine what he's saying.
But hold on, Damon. Here's the thing. Let First Amendment finish off his time, and then we can go into open dialogue. You can cross-examine it. Okay, let's do that. First, you go ahead.
It's a psychological evaluation. You are talking to them if they have gender dysphoria, specifically gender dysphoria. Then typically what happens is hormone blockers, if assuming they're a child, right? And of course, with the consent of the parent. So doctor, child, and parent need to consent. This is required. And then they can be on hormone blockers temporarily. And hormone blockers are only applied as soon as that they start hitting puberty. Then they get a little bit extra time. They're usually on it for roughly 3 years to come to a fully consented understanding decision of what it means to have HRT. And if they still possess gender dysphoria, then they can get hormone replacement therapy. This is a non-invasive method, and it is much less invasive than, say, if they went with HRT much later on in life, which usually requires invasive surgery, such as removal.
So, Damon, you had some questions for First Amendment. Really quick, Teriak, go ahead, finish.
Just one simple question. Is Lupron a drug that they give to pedophiles to castrate them?
Is what?
Is Lupron the drug used to, is that a drug that was used to
I don't know what pedophiles have to do with trans people.
I'm just saying, is that the same drug?
So far off topic.
pedophiles.
The puberty blockers that you're talking about, like Lupron. That is the same drug.
I don't know. I don't know what your pedophiles have to do with trans people.
Because you're giving 9-year-old children the same drugs that you give to pedophiles.
Yes, we give. So if somebody has, say, for example, precocious puberty, there is a medical efficacy to providing hormone blockers to a child with precocious puberty.
Yeah.
They're able to live more normal lives when they have a medical issue. The gender dysphoria in and of itself is a medical issue, and it is addressed with gender-affirming therapy. That's how it works.
And real quick, how long would that precocious puberty would they be on those blockers for at max?
2 years.
2 years. Okay.
Typically
2 years. And then in terms of like that 9-year-old that's undergoing this gender affirming care, they're going to do that for a decade.
Well, they're not on puberty blockers at 9 years old. If you're talking about those,
we'll get to you, Alex.
Specifically with precocious puberty, if they say, for example, go through puberty at 8 years old, they put them on hormone blockers until they're of normal age to have puberty. Then they get them off of hormone blockers. They have puberty.
So it's a short time.